So let's talk about the things you must avoid as a woman who is pregnant. The first thing is avoiding raw foods. So when we talk about raw food, we are talking about raw meat, raw fish, raw eggs, and the rest of them. It's very important that you cook all your meals properly under hygienic conditions. Make sure you cook them properly, because not cooking them properly could lead to you having, salmonella and the rest of them, and that could be really detrimental to your health and that of your unborn child. Also, under foods, you should avoid things like unpasteurized milk and some seafood that are high in mercury, because they are not really good for you as a pregnant woman. As just as I said in the do's, read about all of this and find out how much you're expected to take, because in this video I may not be able to cover all of the food you should avoid and all of the food you should eat. But in all, what you are to eat is whole grains, food that contain a lot of proteins, that contain a lot of vitamins. All of this is just what you need. But when it comes to eating meat and fish, make sure they are properly cooked. If you love sushi, this is the time to kindly avoid it for now. And when you're done, you've given birth to your child, then you can go ahead and have anything you want to eat. So that is it for now. So the next point is avoid high impact exercises. Although we talked about, having to do exercise in the previous part of the video, having high impact exercises or exercises that can impact on you heavily or on your unborn child is not acceptable. Things like judo, squash, kickboxing, or any kind of exercise that will make you to, lie flat on your tummy, or that might expose you to risk of falling, or that may, need you, staying at a height above 2,500 meters. So high altitude exercises is unacceptable for a pregnant woman. The second point is to avoid smoking and alcohol intake. So when it comes to smoking, it's important that you avoid smoking as a woman who is pregnant, because it's been known that women who smoke have a probability of having children with low birth weight or having stillbirth, and probability that their children could have sudden infant deaths. So this is more common in women who smoke compared to their counterparts who do not smoke. And also, when we talk about alcohol, there is no known safe amount of alcohol in pregnancy. So it is important or recommended that you avoid alcohol totally in pregnancy to avoid fetal alcohol syndrome, because this causes a lot of behavioral and mental defects in your unborn baby. So I know you wouldn't like this for your unborn baby, and it's a sacrifice that you need to make, and I know you can make it. And when we talk about smoking, if you really need help to quit smoking, there are smoking cessation services in the UK. For instance, we have various smoking cessation services, be it in England, Wales, Scotland, or Northern Ireland. I'll put the link to all of them in the description, so you can contact them if you need help quitting smoking. But if you are outside of the UK, you can speak to your midwife or your GP, and I am very sure they will have something to help you to quit smoking. So the next point is limiting your caffeine intake. So when it comes to caffeine intake, it doesn't mean you cannot take your coffee. You can have your coffee, but having just a cup or two is not bad. But taking a lot of it can really impact on your child's development. Also remember that you don't get caffeine just from coffee. You can get it from chocolate bars, some energy drinks, and other things too that we eat. The next point is reducing your stress levels. So living in the world without stress is practically impossible, and I understand that, because personally I've been pregnant, and sometimes I feel I'm stressing myself more than I should. But it's really important for you to think about this on a regular basis, evaluate yourself, plan your activities for the day, and when you feel you're getting overwhelmed, it's time for you to rest, because having high levels of stress can affect your baby's fetal brain development. So it's really important that you reduce the amount of stress that you are exposed to. That's why you need to get enough sleep and rest. So listen to your body and always do what is best for you and your baby. Next thing you must avoid is skipping your meals. So as a pregnant woman, you must make sure that you do not skip your meals, because this will not just help you in managing your blood glucose levels, but it will help to reduce these symptoms of morning sickness, that is nausea and vomiting. Because when you do not eat or have enough, glucose, it can lead you to having those feelings of nausea and vomiting. Now, let's talk about another thing you must avoid, and that is avoiding self-medication. Avoiding self-medication is important not just for pregnant women, but for everyone. So, if you're pregnant, it's important that you speak with your medical doctor, your midwife, or whoever that is in charge of your care to make sure that the medication you're taking is safe for you at that time. So when in pregnancy, there are certain medications that are considered, to be safe, but in all, make sure you speak with your medical practitioner before you take any medication. Medications like NSAIDs, non-steroidal anti-inflammatory drugs like ibuprofen, aspirin, and the rest of them. These medications can affect your baby's kidney development, and it is important to avoid taking these medications unless they have been prescribed for you by your healthcare provider, because it doesn't necessarily mean you cannot absolutely take them. There are situations where you might need to take them, but it has to be under the supervision of a qualified healthcare professional. So another thing you must avoid is avoid excessive heat. Now, this is very important because naturally, as a pregnant woman, you tend to feel hotter more than someone who is not pregnant. And this is because of the hormonal changes that are going on in your body. Also, your heart is working harder at this time, in order to support the development of your baby. And also, there is an increased blood circulation. So, all of this put together makes you feel hotter. So, avoid staying in an environment that makes you feel more hotter than usual. Also, avoid, doing all of the exercises we talked about during the time of the day when it is already too hot. This is because excessive heat can increase the chances of having children with birth defects, low birth weight, or having preterm births. So this is something you must avoid in pregnancy. And finally, it is important that you do not neglect your oral care. So your oral care is very, very important. Remember that when a woman is pregnant, a majority of women experience morning sickness. And in this morning sickness, they tend to vomit a lot. This means they tend to have a lot of acidic environment in their mouth, because when you vomit, the stomach contains acid, and when you vomit, some of this ends up in your mouth. And having an acidic environment in your mouth can damage your teeth. So it is important that you have good oral care. Ensure that you brush your teeth at least 2 times a day, or as much as you feel. It depends on you. So it's really important that you do this too, because when you're pregnant, a lot of women tend to have these bleeding gums. Personally, I experienced that. I notice that anytime I'm brushing my teeth, I see myself bleeding. So it's something that you really, really need to take good care of it, even before you get pregnant, while you're pregnant, and postpartum. Because neglecting all of this can really impact you negatively. And of course, you wouldn't want any of that to happen to you. So this is all I've got for you. And I can see it's already dark. Thank you so much for watching today's video. If you've got any questions for me, kindly drop them in the comment section. And I wish you the very best in your pregnancy. I wish you a safe delivery, and I wish you have a healthy and happy baby. Thank you for watching, and I'll see you in my next. Bye for now.